So how the pandemic has impacted South Koreans in 2020, our Kim Myun-sung has this report.
Almost half of the population in South Korea have suffered job losses or pay cuts during the COVID-19 pandemic. That's according to a 2020 social trend report from Statistics Korea of 35,000 households. 50.3% who participated in the study said that their source of income didn't change during the pandemic, but 49% said their employment status has been affected. 14% said that they had lost their jobs, and almost 27% said that although they were able to maintain employment, their paychecks took a hit. 9% said that they had been furloughed. The report also showed that those in the low-income bracket were hit the hardest. Women, minors, and temporary workers experienced the steepest decline in employment. With COVID-19 crippling the country's economy, many think it's crucial for the pandemic to be brought to an end as soon as possible. According to a survey conducted by Seoul National University on 1,000 people, almost 80% said that COVID-19 prevention should come before individual rights. The study also revealed that up until May, more people found the social repercussions and shame that follows a COVID-19 infection more intimidating than the virus itself. South Korea tops the composite index for efficient response to COVID-19 among the 33 OECD nations. The country has also secured vaccines for 88% of its population, with shipments expected to begin in March next year. Kim Hyun-sung, Arirang News.
If you're just tuning in here on Arirang, we are waiting for a briefing to begin from the South Korean health authorities. They'll be giving us updates on the data on the pandemic, the outbreak here in South Korea, as well as any possible new measures the authorities have decided to take today. They were reportedly considering instituting new social distancing measures. We'll find out about that in just a minute. Now, after being forced online by the pandemic, the art industry is trying to find ways to reach its new digital audience. One innovation has been to break up long plays and musicals into shorter content for YouTube. Our Kim Bo-kyung has this report.
This is a web musical. It has been divided into 9 episodes, each one lasting just 10 minutes. As the pandemic has made it difficult for people to visit theaters, lots of major shows are streamed online. Most people are used to watching short videos instead of full-length musicals, so show providers such as EMK Entertainment came up with a new format. The head of the company says web musicals have some advantages over the original versions.
When the show is on stage, there are limits on angles as cameras need to be installed far away. But viewers can see actors' expressions up close like in a movie or drama because this musical was created as a web version from the start.
Seoul Art Center is also trying out short-form content through play clips, which is a play told through 5 short clips. Though the storyline needed to be made more compact and cooperation between the stage and video producer was needed, the producer says it is a great chance for actors and creators to try out new ideas.
I heard that other theater companies are also preparing similar short-form content. As it is made for the audience to casually access the videos, I believe it will become one of the new genres even after the pandemic, and perhaps even make people come and see the real show once the pandemic is over.
Viewers can purchase the full package of EMK Entertainment's new web musical, Killer Party, at Naver V Live until December 13th. Seoul Art Center's play will be uploaded every Tuesday through YouTube channel Zach on Screen. Kim Bo-kyung, Arirang News.
In other news, virtual reality is giving people opportunity to learn highly advanced medical techniques such as brain surgery, or letting them see up. We are getting news that the briefing is starting now. We're going to cut straight to that and listen in.
We also have Tae-ho Yoon from the Central Disaster Management Headquarters present, and we have Sang Chang-jun Yu, who is in charge of the hospital's beds, present as well. And we also have Choi-jun Woo, who is in charge of the Ministry of Education, present as well. We will also be providing sign language translation. First, we will hear from Minister Bang Neung-hoo. Hello, I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-hoo. Dear citizens, right now we are facing the official third wave of COVID-19, and we are experiencing it right now. Right now we are seeing a great increase in the number of patients. From December 7th to 13th for the past week, daily average number of newly confirmed cases amounted to 722, and it was 540 in the metropolitan area, which is around 75%. In Korea, the number of newly confirmed cases has risen to be exceeding 1,000, and it was quite high in the metropolitan area, which amounted to around 800. So we are seeing a sharp increase. We are raising the number of screening tests, so we believe that the number of patients will continue to increase. And in order to curb this as much as possible and as quick as possible, we're going to expand the number of capabilities fast, and we are trying our best to control COVID-19. If the current trend continues and if the patient continues to increase, our medical system will face a limit. And it means that the fatal damage will increase, and we will also have an influence on the treatment of people with other diseases. And for the past 10 days, I believe that a lot of the citizens have tried very hard to prevent the spread of COVID-19, and we do understand that you are very tired. However, the control of COVID-19 is even more serious, and in order to help out the medical personnel and those who are preventing the spread, we have to come up with some time for them, and we have to work together with the government to do so. And we believe that that is the only way for us to control COVID-19 and also to minimize the number of increased cases. We have tried out an increased level of social distancing. However, we have not seen the effect of it yet, and the movement has not decreased. We do understand that you are feeling tired due to the continuous social distancing. However, we want to ask you to minimize your activities and stay at home as much as possible. Please consider the significance of the COVID-19. And with the severity of COVID-19, today's CDC meeting was held and led by the President. And we have tried to come up with measures so that we can increase the number of hospital beds as much as possible. Now I will explain to you about the measures that we have come up with the metropolitan area. So in the past week, we have seen an average level of 540 for the past week for the newly confirmed cases in the metropolitan area, and it was more than 780 yesterday. And we are trying to secure as much as hospital beds, and we're going to secure them so that we are prepared for the worst case scenario. So we're going to assume that there is 1,000 newly confirmed cases happening on a daily average for the next week, and we're going to secure hospital beds enough for the next 3 weeks based on that assumption. And we are going to secure 7,000 hospital beds in the live treatment centers, and also 2,700 for the infection beds, and 300 for those who are severely ill. For the live treatment centers, we have around 2,700 hospital beds available. However, we're going to expand it to 7,000 so that we can have around 10,000 hospital beds in total in the live treatment centers. We have around 2,100 hospital beds remaining right now, and we're going to additionally secure 4,000. And we're going to operate 22 live treatment centers in Seoul and the Gyeonggi province areas. And also for the CDC, we are also going to open another 3 live treatment centers as well. And there are live treatment centers that have stopped operation, so we're going to reoperate them by reopening them. And we're going to secure additional 1,500 hospital beds by doing so. And also for the hospital centers that are focusing on the infections, we're going to expand the competence in that as well and the capacity. Right now, we have around 44 additional hospital beds for those who are severely ill, but we're going to expand that number as well. And under the government, we have hospitals available. So through those hospitals, we're going to secure more than 1,000. So it will be also 500 in the metropolitan area and 200 from other provinces secured first. And for those who are already entered into the hospitals, for those patients, we're going to make sure that those are transferred to the required hospitals. And for those who are severely ill, we have 320 hospital beds being used right now, and we're going to secure additional 300. Right now, there are 13 available hospital beds remaining, and we're going to secure 288 more on top of that. And also for the Seongnam Hospital, we're going to secure 5 sites as those who are focused on those who are severely ill. And we're also going to secure additional 150 hospital beds. And we're also going to secure hospital beds that are dedicated for COVID-19. And in addition to the 10,000 total hospital beds that we're going to secure, we're going to also expand the number of hospitals that are dedicated to COVID-19, and we believe that by doing so, we'll be able to get even more hospital beds. For the details and the schedules on the hospital beds, please refer to the press release documents. By securing such hospital beds, we're going to minimize waiting time, and we're going to ensure that people are not taking too long waiting for the hospital beds. So in the metropolitan area, there are around 580 people waiting for hospital beds, and there were 56 people who waited for more than a day. So we're going to make sure that this number is minimized. And we also have to secure more personnel to control COVID-19. Therefore, we're going to do so. So we're going to have 280 doctors be sent to the sites. And we are also securing more those who are working in the personal clinics as well. So we are also securing more nurses, and also we are securing additional personnel who will be volunteering as well. And with the countermeasures against COVID-19, there were medical personnel who have applied for this, and we want to thank you for doing so. The government will also expand the resources on the medical supplies so that our medical practitioners can focus on their work only. And especially for the nurses working on the intensive care units, we're going to pay the risk charges. And we're also going to make sure that the additional fee goes to all of the nurses. And for the hospital beds and for the negative pressure hospital beds, we're going to also think about increasing the cost of those hospital beds by twice the original number for a temporary point of view. The government for the COVID-19 is trying to prepare against COVID-19, and in order to also reduce the gap in the regions, is going to work with local governments to strengthen our public work system. We're going to ensure that all citizens can actually experience high-quality medical system, and we're going to come up with 3 measures to do so. First, for the infections and the emergency diseases, we're going to focus our work there. So until 2025, for those regional hospital beds and other 20 hospitals, we're going to additionally build them so that we can have more hospitals available for our citizens. And in order to expand the number as soon as possible, we're going to focus on the Busan area, Daejeon area, and the Jeonju area, and we're going to have exemptions for the feasibility test for building new hospitals. And we're also going to improve the public works in those areas as well. And for the areas that have a difficulty in securing budget, we're going to increase the budget from 50% to 60% for the next 3 years. And for the public hospitals, we're going to make sure that this is a safe and high quality hospital. So we want to make sure that we improve such hospitals. And for the negative pressure emergency hospital beds, we're also going to increase the number in large. Secondly, we're also going to secure the required personnel and support them. For the doctors, we're going to make sure that they are getting better training, and we're also going to focus on the specialist doctors. So we're going to also expand the training for the doctors so that it is not only happening in the university hospitals but in regional hospitals as well. Starting next year, for the nurses working in the public medical systems, we're going to also select more nurses, and we're going to also expand our nurse training system. And for the medical practitioners and for the details, we're going to have a cooperative body so that we can have sufficient discussions about it. Next, if we're going to ensure that there is no gaps in emergency treatment, so we're going to come up with a regional system to do so. So we're going to come up with the public and private hospitals designated so that they can act as hubs. We're going to have more than one per region. So we're going to designate 96 in total across the country. And we're going to have priority hospitals designated starting next year. So these hospitals will have emergency hospital beds available, and we're also going to provide incentives for the operation. And when there are also patients, and for the diagnosis on those that are prematurely born and those that are newly born, we're going to provide even higher incentives. So we are trying to enhance our medical system so that it becomes even better, and we are trying to make sure that we are protecting the valuable lives of our citizens. So we are going to do our utmost to do so. Citizens, right now we are facing a third wave of COVID-19, and we have to make sure that our citizens work together with the government to be able to overcome it. If we see the current trend continue, we're going to see a collapse in the medical system. And in order to prevent this, we may have to raise the level of social distancing to level 3. And in preparation for that, we're going to gain and collect the opinions from the local governments and the experts and consider elevating the level of social distancing to level 3. However, this is the last resort, and it will negatively affect the economics of our citizens. And the stopping of operation of many different businesses will no longer be a recommendation, but something that is enforced when social distancing becomes level 3, and this may cause a lot of difficulties for a lot of people. So right now we are in the last opportunity to stop us from going into level 3 of social distancing. We have to make sure that we prevent such a situation. So we have to make sure that we add power and we energize those who have helped us until now. Our citizens have overcome 2 waves of COVID-19 until now, and we believe that this third wave will be able to overcome if we come together and cooperate, and I have confidence about that. So we need the actions of our citizens to take place. So we want to ask you to stay in the safety of your home and minimize moving as much as possible. Please refrain from going to confined, crowded, and closed spaces where there could be increasing contact. So please avoid those places. Please make sure to cancel any gatherings and reservations that you have, because any place can be a risky place for you. And please make sure from also refraining having family gatherings as well, because that could also be risky. And when you're going outside, please make sure to wear your face mask in an appropriate manner. Even if you were to take it off for a little while, it could be dangerous. Please make sure to wear it when you're inside. If you have any symptoms or if you are suspicious, please make sure that you get tested. There are non-symptomatic and the dormant infections, and those are hard to capture. So we have to make sure that we cut off this chain of infection so that we can protect our families and friends. If you are minimizing your gathering by even by once, then you are lowering the level of possibility of COVID-19. And we believe that we'll be able to curb COVID-19 if you get tested when necessary. So we ask you to take action. The government has confidence about the power of our citizens and the potential of our citizens. So we believe that we'll be able to overcome this. Thank you.
예, 지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at the top of the hour.
As the third wave of COVID-19 sweeps